No, don't worry, we are not going to talk about any crazy stuff in this video. Actually, adjustment can be dangerous in some situations too.
A 28-year-old woman lies paralyzed in the ICU. The result, her family says, of a neck adjustment by a chiropractor.
This is my MRI in 2017, and 9 out of 10 doctors told me I have to do operation for my back. But I didn't, I worked on it, and now I'm pain-free. I play basketball again, and I go to gym regularly, I run, and everything is fine. So in this video, I'm gonna show you how you can fix your back easily with a step-by-step guide. First, we are going to talk about the type of back pain we have, and then about the mistakes that people make when they have back pain. And then I'm going to give you a step-by-step guide how you can be back pain free. And at the end, I'm going to give you some tips and tricks that you can use when you have really bad back pain to have an instant relief. So let's get started. Hey friends, if you are new here, my name is Komran. I'm a sport therapist and a sports scientist doctor based in Berlin. So first, let me talk about the 5 most common reasons that people have back pain. The first one is a muscle or ligament strain, which means that if you carry something heavy or you move suddenly, you might injure your muscle or make a small tear on your muscle or ligament, which can cause you pain. The second one is herniated disc or bulge disc, which means that if your disc is not healthy between your vertebra, you might have some bulging disc or some herniated disc that can have some side effect in your body. The third one is degenerative disc diseases. As I said before, we have a cartilage between our vertebra, and when this disc they are not performing very well or they have problems, we can have a lot of pain in our back. The fourth one is arthritis. The arthritis is really famous. When the space between the bones or between the vertebra is getting less, you have less space, and that can cause you back pain. And the last one is sciatica, which can come from either herniated disc or sciatica by itself can cause you some pain. But for all these different common back pain problems, we have a procedure and we have a step-by-step guide. And in this video, I'm going to explain to you how you can prepare yourself to fix your back pain by yourself as much as possible. But first, let me talk about the mistakes that people make when they have lower back pain. When we have lower back pain, the first thing we try to do is do some sudden movement right to left or cracking our back to feel better. Because we saw in YouTube, in Instagram, in all social media, there is people that are chiropractic and they do this sudden movement to the people, and after that they don't have any pain, they can walk properly and there is no problem and everything is good. But I'm not gonna say that that's not correct, but I'm gonna say that first of all, they're chiropractic, they are specialized in this area, so they know what they do. And the second thing is not gonna work for everyone. And the third thing, you shouldn't do it by yourself. So if you have a back pain, you gotta rest for a couple of days or a couple of weeks to make sure that you can recover from that, and then talk with your specialist about that. Regarding resting, the second mistake that people make is that they're resting too much. Resting should be around 1 to 2 weeks after you start having pain. More than that is not going to be suitable. Sometimes when the doctor suggested that you can go for like 3 weeks or 1 month, but not more than that. And the reason is when you are resting, you're not using your muscle. When you are not walking, when you are not using your muscle, you're going to have atrophy in your muscle, which means that your muscle getting weaker. And the problem with that is they cannot support your spine and your vertebrae anymore. And that can cause you extra pain when you start doing an activity. So I'm suggesting that if you want to rest, maximum 2 weeks is gonna be good enough. And the mistake number 3 is that they're stopping all the activities that might cause them some pain. For example, when someone has lower back pain, they stop bending over and grabbing something from the floor because they believe that that movement can cause them pain. That's correct, but you gotta make sure that You prepare your body for that position or that situation that you're gonna deal with it in the future. You cannot say that, okay, because I have herniated disc, I'm not gonna bend over anymore for the rest of my life. You have to prepare your body for that situation, which we are going to talk about it right now, about the recommendation that we give to our patients, how they can step by step increase their muscle strength and their function so they can move better and they can do the exercises or the movement that is good for their back, and they don't be worried about, oh, this exercise or this movement can cause me more pain or is gonna cause my herniated disc to get worse. So our recommendation is, the first thing first, you have to start moving. Moving is really important for the back because you're going to activate your muscle. But you cannot say that all type of movement is good for you. First, you're going to start with the static movement or isometric movement. Isometric movement, they are type of movement that you're working on the muscle but not on the joint. For example, when you do static back extension, I try to put the video somewhere here so you can understand. When you do the static or isometric back extension, you're going to work on the muscle on your back, but the spine is not moving or the vertebra, they are not moving. So you're strengthening your muscle and condition without moving your spine, which is really good. Then this is the first step. Then the second step, you're going to add some load to it. Progressive overload. It's really important. You cannot say that, okay, I'm going to do this isometric 30 seconds for the rest of my life. No, first 2 weeks, 3 weeks, you might be in 30 seconds, and then you have to gradually increase it to 40 seconds, 60 seconds, 2 minutes. And then when you can reach like certain amount, like 2 minutes doing back extension properly, then you have to start the dynamic movement, but without weight, which is going to be like back extension in the pain-free range of motion. So you're going to do the back extension in pain-free range of motion, 10 to 20 reps. And then when you get better at it, then you're going to add some load. So in conclusion, it's going to be static or isometric, and then static overload, which means that you're going to increase this static movement, and then it's going to be dynamic, and then it's going to be dynamic overload. So you're going to make sure that you can increase the intensity down the road, but you have to be really careful how fast you increase the intensity. This process takes, I don't know, a year. For me, it took 2 years to get better. For me, the first phase, which is like isometric movement, I think it took around 6 months to start from 30-second back extension to 2 minutes back extension. So you shouldn't rush to do really dynamic movement, really heavy one. You have to take your time and then slowly increase it. And whenever down the road you feel like, oh, the exercise is too hard and they might cause you some discomfort, or when your pain range is going from 2 out of 10, for example, 2 out of 10 is a good like way to measure your pain. Like if it's 2 out of 10, which means that you are okay, you might have a bit pain, but it's not that crazy. But above that, you have to be really careful. Whenever you have too much pain, because in this whole process of the treatment, you're gonna have a lot of ups and downs, and you might feel more tension or more pain some days. So in this condition, you have to go to your basic again. You have to go to your isometric movement, but you gotta make sure your average improvement is always upward, and that's really, really important. So static, overload the static, dynamic, and overload dynamic. That's the whole concept of improving your condition step by step. And as I said, don't forget to be patient. That's the most important thing. It might take ages, like for me, took 2 years to get better. So be patient and trust the process. There's a few exercises that I really recommend to the people to start with the isometric for the back, which is like back extension isometric or dead bug or Spider-Man. These are the movements that they are really good for the back. But if you want to know about the full exercises that you can do at home in different phases, please let me know in the comment. Either I'm going to send it to you, or I'm going to write down in the comment, or I'm going to create a video about it so you can use it later on. Now, just imagine that you know all this stuff, you start doing all of them, but some days you're gonna have a lot of pain and it's gonna be frustrating. You cannot move, you cannot do a lot of stuff, and this nerve pain is causing you a lot of difficulty. Now, I'm gonna give you 3 simple moves that you can do it every single day to make sure that you recover from that pain and you're gonna give an instant relief from these moves. The first one is really simple. You just have to lie on your back in really hard surface. I prefer on the floor, and then maybe I'm using a blanket, but that's it. Lie on the floor. Put your foot on top of a chair in 90-degree angle on your knees and just hold that position for 10 to 15 minutes. It's perfect. It's like a magic bean. You can do it every single day. And honestly, I'm doing it once in a while when I feel like I have done a lot of moves during the day. Because during the day, we walk, we stand, we sit a lot, and there's too much pressure on our spine. But lying down on the floor can give you this decompression on your spine, which feels really good, and it's gonna give you this instant relief. The second move is that you can lie down on your back and then put your right foot on top of the left knee and then try to bend your knee and rotate to the left side. I'm gonna show you the video so you can see it better as well. So you're gonna hold this position 2 minutes, 3 minutes, so you can have really good stretch on your lower back and also this decompression on your spine too. You can do for both sides. And the third one is again a simple move, is lying down on your stomach but in a hard surface like a floor. Again, you're gonna lie down on your stomach, you're gonna just breathe and just enjoy the moment. Sometimes you can use your elbow to go a bit higher and have this extension on your back to give you more stretching. Just remember, around 80% of the people, when they do this move, they feel really good about it and they have like instant relief. But for 20% of the people, they start having more pain. And I was in that 20%. So if you start having pain, just stop doing the last exercise. But for the rest, you're gonna be okay. And at the end, I'm gonna tell you again, if you have any pain during this movement, it's above 2 out of 10, just rest, talk with your doctor or physician and see what's going on, and then get the proper exercise or proper movement for your specific condition. So at the end, it's really important to understand that you need to be active as much as possible. Hope you enjoyed this video. Please let me know in the comment if you have ever experienced back pain and what did you do and how's your condition right now. Thank you for watching and catch you in the next one.